Dr. João Paulo. Are you okay? Yes, I'm fine. As I told Cristiano, I knew your work at a conference, Free Mind Conference in 2016, and I was delighted with Dr. Bartô, and I saw another lecture of yours. I'm not sure, but I think that I greeted you because I'm very shameless. And thank you so much for your invite. For the ones who don't know him, he is João Paulo Becker Lotufo, and he is a pediatric pulmonologist at University of São Paulo. And he is very active in the combat of alcohol and drugs. He has a very strong work related to tobacco, and he has a prevention project in schools, elementary schools and high schools for kids and teens, and he's going to talk about it to us. And first, I would like you to present yourself of your work as a pediatrician, your work on the drug and alcohol prevention, and please talk about Dr. Bartô project and everything you think is pertinent. Please, feel free, because I only want to listen. I have a lot to learn. Thank you so much. I'm a pediatrician. I am a pediatric pulmonologist. In the 2000, I went to Europe in a conference, and there was a group in Europe that were having the hospitals in Europe a free tobacco environment. I brought this material to Brazil, and then I started to work in hospital, São Paulo University Hospital. It had to be a free tobacco environment because they used to smoke inside the hospital and even see patients there. So in 2004 and 5, we had a quiz with the employees, and they decided that we did not have to have tobacco smoking there anymore. And then São Paulo only became a tobacco-free environment in 2009, and Brazil only in 2014. So in fact, it was a big fight. And as you talked about a lot about the age range, in what kind of age we have to work with prevention of drugs, I tell you that there has to be intrauterine, because this is very important. Then I had a book which is Tobacco as a Pediatric Disease, and I was very helped about it at first. Then I started seeing patients in my office. They were 14, 15 years old, and they had alcoholic comas. I'm not talking about only throwing up in the bathroom. It's alcoholic coma, hospitalized. Then alcohol also entered my fight. And then I saw lots of psychotic breaks and schizophrenic people. Yeah, I saw. And also because of marijuana. And we are now sponsored with the Brazilian Society of Pediatrics. And I had another book, Tobacco and Marijuana Are Pediatric Drugs. And in fact, I started working with brief counseling. What is this? In the hospital, our residents in our medical clinic, our pediatric medical clinic, they are supposed to be working 2 to 10 minutes, in an average 2 to 4 minutes, talking about drug prevention in the families. They have to say what the risk is of having their children smoking or drinking. Because if the parents smoke, the risk of the child is to be a smoker. If they drink, the risk is that the children risk. So they have to talk about the risks and the probability that their children will be doing this. After this brief counseling, we are going to have a brief intervention. And then you're going to spend more time with these young people because they are already having drugs or doing drugs or drinking. And we have in the research a smoking cessation from 1 to 15% if they talk about it. This is too much. For example, the flu shot prevents 15% of the elderly not getting a cold. So, if they do it with the flu, why not doing this with smoke cessation? We have to be 1 to 15. This is a lot. If the pediatrician not only does the brief counseling, they can help also the family to stop drinking or doing drugs. Because if the family uses it, the child or the teenager have more chance to use it too. This is what we do in the level of medicine. And then I am introducing this topic in conferences or in lectures. Last year, we had 14 lectures to doctors because the doctor has to understand that this is a very high problem. They have to prevent it the same way they prevent other diseases. Then in 2013 to 14, we started a project in 10 schools near University of São Paulo, and they were sponsored by USP. Now it's very, very difficult, but they could. The University of São Paulo Culture and Extension Centers helped us. As everyone knows, the drug prevention, teenagers start with drugs very early. And we have got to delay this. And we saw it that if families discuss it at home, it's going to be much easier. So the families has got to pick up the material we prepared and discuss it with their families. Because there is a 60% less users. 60% less children are going to use it if they discuss it at home. And this is very, very important. I really think that churches have to discuss this with children, and spirituality is very, very important. And there are many examples that I can show. For example, one of the schools, the math teacher worked with a question in the test. For example, if your parents smoke 2 packs of cigarettes a day, and he or she has been smoking for 20 years, how much did he spend? So the answer was 14,000 reais in these 20 years. And it was a big mess in the classroom. Because you see, they were very surprised with this number. Then I was at a place with Dr. Bartô book, and a parent approached me and said, "You are very naughty. You talked about that. Now every time I lit up a cigarette, my son approaches me saying, 'Oh, I want my bike now because you are spending lots of money with this addiction of yours.'" And on my medical clinic, I see that 30 to 40% of people who go there to stop smoking, they go there because of their children or their grandchildren. And a 70-year-old man came to my office to stop smoking, and I asked him, "Why are you coming here so late in your life? Why? I don't understand." And he told me, "This is because of your Dr. Bartô brochure. My grandchild came home with this booklet, and every time I start smoking, my grandchild says, read it again. So I have already read it for 60 times. I cannot do it that anymore. I need to stop it. And then I had another family, a mother with a kind of bronchitis brought 2 children in my office, a 10-year-old and a 2-year-old. And this time, 15-minute time, they were there. The mother told off the older boy many times, and I found out that the 10-year-old gave away his 10-year-old boy, he was 8 at the time, to their parents. So the grandma was going to take care of this child because they had another child. So see, when they are together, the 10-year-old spanks the 2-year-old, and the 2-year-old father spanks the 10-year-old. So do you feel what a messy situation they are? Asthma is the least of their problems. And then we had to engage on another level, a psychologist, a psychopedagogist, in order to lessen the problem. So this is what we have been doing. I have been going to some cities. We went to São João de Nepomucemo in Minas Gerais. I drove 10 hours with my car, with the brochures, because a pal of mine insisted a lot that I went there. It was a very simple and friendly person. And he could do in his city a national week prevention. Can you imagine someone on a minimum wage in a 29,000 people city? He could put together a national week prevention. We also had another National Week prevention in Caraguatatuba. But the big problem of this prevention work is that they have to keep going. They have to have a continuity. So, this is why we work with brief counseling, because we can talk to people every week, every month, and have a continuity. When I talked to a congresswoman, she was still a congresswoman for São Paulo, I showed this problem to her, to Luisa and Udina. And she asked me, why didn't you show me this project while I was mayor? Then I could do a big project that could help much more people. Because when we are going to talk to the politician, they say, there is the ProEd, which is a project that they have. And then I talked to Marta Suplicy. I said, no, I cannot start another project because we already have ProEd. But this ProEd, this project that they have in São Paulo, it's aimed at teenagers and not at younger children. So if we can put a project together, I'm going to make my material available, and then we can go other things. So there's the difficulty to sum other efforts to the efforts that are already there. And we need to do it. So at Unifesp, Stella is studying, is thinking how this ProEd program is a good one. Is it working? So they are thinking about it. In fact, we need to add more things. I am never going to see all of the schools. This is totally impossible. But we can help with more people. We can help more people. I have tried to talk to these politicians, Marta Suplicy, Haddad, João Dória, and Luiza Erundina. I couldn't talk to them. I only could talk to Suplicy, Marta Suplicy, and Luiza Erundina. But the other ones, I talked to their assistants. And we were thinking about having one teacher at every school that would be trained and would be going on with this project. so that the project would have a continuity, could go on throughout the year. In Paraná, they have already had something about it. So we do not have access to the education board. It's very, very difficult. If you go to Brasilia, there is the National Cancer Institute, but it's very difficult to start working with them. We do have to unite ourselves and have a very strong and big project with drug prevention. Nowadays, we have been talking more about it, the drug prevention. But in fact, the things are not going on the way we would like to. The families also can have their brief counseling. This starts when the children are very young. And we have this brochure here with a toucan. For example, I have to print these booklets myself. I could print some books with donations, friend donations, patient donations. I could raise 15,000 reais. Each brochure costs 1 real. And then I could print 1,500 brochures. And then there's a businesswoman that helps us every 6 months, every year, anyway. And we keep going in this way. But we do not have big support so that we can do it massive. We are worried with the statistics, academic research, when people are doing these big things, we think that brief counseling is very useful. We do it on our daily work, as my other Paul in the other live told us. So we created this character, and this character, Dr. Bartô, is the reference for these children who get in touch with this material. So I have patients in the medical clinic. They come with a complete collection of these materials. And we have videos. And the project, Dr. Bartô, is very broad, right? There are jamborees, theater, it's something very broad, right? In fact, we have 9 interventions in schools in that first project. We talked to the teachers so that they could understand the project. And classroom, we worked with 190 classrooms. So there's sports, there June Fest, closing parties. We go with a band, a music band, and all of these cost money. So it is an expensive project. But if we only can hand in 4 brochures a year for the schools, so that schools can work with prevention, this is very, very useful. A teacher from Osasco asked me the material because she would like to work with this material with her classroom, but she didn't have the material so that the whole class could read it at the same time. So I donated her the material, and she could work with the class, with everybody reading at the same time. So there are many options. The initial project to be developed in schools is a project that's from Iceland. And we have to have more cultural and sports activity in schools. There are many schools here, especially the one who have night classes. There's nothing there. The situation is catastrophic and is going to get worse. Yeah, they want to have online classes. The human touch is very important. Yes, we have to have more activity in schools? Isn't there a teacher who can put together a drama class, or a teacher who can play the guitar? And goes on. And the example we have, there's a school, application school at USP, Universidade of São Paulo. This teacher is developing a very nice work with many activities, drama class, music. There are many, many options. The parents and doctors, many, many options. And we have to work in this way. Family is important, and I have some data here from that was the National Survey of School Health Brazil, that was published in 2016. Girls are the ones who drink more, not the boys. Public school uses more than private school. In private school, I was going to one of them to have a lecture for parents. This is not very fruitful. From 2,500 students, only 35 parents were there. This is little, too little. But what happened? Later on, they called me at the school because they found a drug distribution network inside the school. Then I went there in order to talk to them. So I said, you have two choices. One, or you expel the children, or we bring the parents to talk about it. This is what I think has to be done. And then they did it. And then I asked, what are you thinking for the parents? And the first one said, I'm going to move schools, change schools. And then I asked him, where are you going to put your child? Only if you go to Mars. There you do not have anything, but it will get there. And the other one said, I want the school to expel my child because he's going to learn. And then I asked, what are you going to do before the school? The third one scared me the most. He said, I do not talk to my son in 8 months. We fought, we got aggressive, physical, and I do not talk to him anymore. So this is the big problem. How they deal at home. So we have some work going on in this way. Another very important thing is, if the children do not live with the parents, the drug use is much, much higher. In the pool, we had 38% of the children live only with the mother, only with the father. And 4% of the children had deceased parents. Meaning, family structure is very important. Something very important is, if you can have your meals with your parents, the drug risk diminishes a lot. This is basic. I'm not talking about it's not any rocket science. It's very simple. Have your meals with your children. But now we have the hack of the microwave, that everyone heat up the food anytime as they want and do not have meals anymore. Something else which is very important too, parents that check their children's homework. If they do that, the risk of doing drugs is very small. This is very basic. We are not talking about miraculous things. It's something about something of our daily lives. And I agree with my other friend said that school is a protection factor. Living with the parents is another protection factor. Having meals with your children and knowing what your children are doing, who are they talking about, this is very important. And having a very nice relationship, and do not smoke or drink at home. the parents. This is very important too. You have to give the example. And another important thing is the number of sexual partners you have. If you have multiple sex partners, the risk of doing drugs and drinking is going to be higher. I have a medical clinic with teenage children because teen pregnancy is another issue. I have seen many mothers aged from 12 to 17 years old. They are pregnant or they had children. When I talk to them, I see that this is related to drug use, marijuana especially, that they get in touch with this in parties. Then they end up getting pregnant and they do not know who were the fathers. And this is a very severe social problem, which is an unplanned pregnancy. Then I ask them, they tell me, everyone uses drugs. No, this is not true. This is not true. In your street where you live, is there anyone who doesn't use it? They said yes, people that go to church. So spirituality is something that helps as well. And it's very difficult to discuss spirituality with children. I do not want to convert anyone into my religion. I want the family to have some kind of spirituality. This is very important. As I told about these 5 topics. So family is the first one. Family united, imposing limits. Limits is important. Spirituality, this is for sure very important. Cultural and sports activities, this is fundamental. Social activity, life is not only going to parties on the weekend, so there's got to be a social project. And since your children are small, you have to teach your children to do that, cultural and sports activity. And then know what and where your children are and what are they doing. We have to enhance the drug topic discussion at home, at school, at church, and in the family, within your family. So, when I'm going to talk about drugs on a medical clinic and any kind of seeing patient, if I'm going to talk to the teenagers, I'm talking to the teenager and the parents together, not only the brief counseling. Afterwards, maybe the teenager can be alone, but in the beginning of the brief counseling, the family has got to listen to it. Example, if I talk to a teenager who is 14 years old, in the 3rd gestation, she's pregnant for the 3rd time, this is not possible. Has got to have more discussion. Then they have to understand. For example, if you got your period here and then there, when are you going to get pregnant? They don't know. They do not have information. In a private practice as a doctor, in the public practice is not different. I have teen pregnancy in a private office as well. I'm not going to ask a teenager if she has sex or not in front of their parents. I'm going to ask her if she knows how to prevent another pregnancy, if she knows sexually transmitted diseases. I'm not going to ask a boy if he has used marijuana or not. I'm going to ask him if he knows the risks of doing drugs. What happens? The parents are very, very grateful. They love that I talk to their kids this way because they have difficulty to discuss this with their children. Children do not want to talk about it with their parents. But if doing this way, we open dialogue. And doctor, This brochure, the toucan, Dr. Bartô, are they available on the internet? Or are they available? Yes, they are available for reading. And in the last free mind I participated, you can read there. We print for the free make because there's some quality. Now my question is this. Suppose a teacher wants to print for their children. Does she have to get in touch with you for authorization? No authorization needed. But we can send the brochure if you get in touch with us. We have already printed. What happens? Hi, doctor. You broke down. Now it's back. It froze. Then the person can print. I'm not sure if the person can print, but they can read on the computer. Okay. Yes. Now, on my last free mind, I met a friend who can't see, and we exchanged many ideas. He's blind. And we decided to have Dr. Bartô in Braille. So we already have 4 brochures of Dr. Bartô in Braille. Not many blind people can read in Braille. We also have now an audiobook. So an artist and friend recorded for me. So on the website you can listen the stories, Dr. Bartô stories. Hey, tell me, Insta is telling me that the live is going to be finished in 20 seconds. I'm going to finish and start a new one so that you can say goodbye, okay? Hi, doctor. Okay, I'm back. Yeah, so let's finish properly, right? The information was so nice. So, the book we have a Braille version. Yes, the Braille version, then the audiobook. Then you can listen to the stories. Then this material is on the Dr. Bartô website. drbarto.com.br. If you Google it, Dr. Bartô, it goes there. And then you can see everything we do there. Let's see if we can develop more work and print more things. Anyway, we are super willing to do it. Yeah, I study pedagogy at Federal Fluminense University, and would like to distribute it to my students. I already talked to Cristiano about it when we are having classes. It was math. The subject was math. How we can introduce the math to children or Asia, which is youth and adult education. And I proposed to deal with some alcohol issues. Then my group mates said this wasn't a theme for small children and only for young and adult education. I would like to discuss it more, but I was minority. Then we talked about sugar. But I would like to discuss alcohol, but I said that wasn't a topic to deal with children. And what you show to me, that is the opposite. This has to start in the intrauterine. And I learned this topic today. So, for pedagogy students, it's important to know this, because many times the teacher doesn't know how to deal with it. maybe it would be very important. I'm not sure how we can do it, but it's something to be introduced in the pedagogy student background. Only one subject about it. Yeah, about prevention. Yeah, about drug and alcohol prevention. Doesn't exist. There isn't a subject about it. This is something that happened at a federal university. There are many campi which has this pedagogy course, and I was very, very sad to see how our group mates were thinking. We have to change their mindset. Everything goes according to the information. So I appreciate, I'm going to print your booklets, and this is it. As I told Cristiano, that mother of Calcutta sentence, I'm going to repeat. What I do is a drop in the ocean, but without it, the ocean would be smaller. As you said, we have to cooperate. This is very important. So, someone who would like a technical book, Alcohol, Tobacco, and Marijuana, Pediatric Drugs. I did this with the Brazilian Society of Pediatrics. If you want, you send me an email and I send you the book via mail. You only pay the mail and everything is okay. So, www.drbartô.com.br is our website. Thank you very much. It was a pleasure. I would like to give you a hug in person. I already know you from the lectures. Thank you so much for your work. It's very important. Thank you. Bye-bye. It was a pleasure. I would like to give you a hug in person. I already know you from the lectures. Thank you so much for your work. It's very important. Thank you. Bye-bye.